wanted to share my experience of motherhood and the journey of motherhood with all the young parents. And so I started an Instagram page called My Little Pram, wherein I discuss a variety of topics related to pregnancy, postpartum care, baby care, nutrition, and so on. I have recently earned an international certification in maternal and child nutrition, so that this is one more feather in my cap. Here, I would like to take an opportunity to thank Baby Chakra for inviting me to discuss a very important topic which most of you might not be really aware of. And what is it exactly? It is nothing but tongue tie. So, before we delve deep into the topic of tongue tie, let me tell you why I chose this topic. That is because, being a new mom, my son had a tongue tie. So, this is a condition present at birth. Well, let me tell you, the tongue is one of the most important organs of our body. It is the epicenter of our body. And why do I say it is the epicenter? Because being a sensitive organ, it can perform a variety of functions like speaking, swallowing, suction, tasting, and so on. Um, Now, why exactly am I highlighting this particular thing as tongue tie? That is because if there is any kind of problem or disorder associated with our tongues, there can be a range of problems which we can face. If a particular problem is not detected or evaluated at birth, the baby can face a lot of problems. Now, why do I say it is the tongue tie is an hidden enemy? Is because it can create problems to both the baby and the mother. Now, a lot of mothers they have problems with breastfeeding, and they say कि मेरा बच्चा दूध बराबर से पी नहीं रहा है. They think that there is some fault with themselves. Um, it can be, but the baby's tongue has not been evaluated at birth, so that can also be the problem with breastfeeding. Now, what exactly is a tongue tie? A tongue tie, as the name suggests, okay, it's a birth condition or a congenital condition wherein the baby is born with this kind of, I cannot say a defect, but a deviation from normal. So, in a tongue tie, a strip, a small strip of small strip of membrane is attached to the base of the tongue, and the tongue is attached to the floor of the mouth. So the baby can't have any kind of motion which the tongue usually performs. Like the baby cannot protrude the tongue, the baby cannot lift the tongue, it cannot rotate the tongue. So the baby starts experiencing a lot of problems because of the restriction of tongue movements. Now, if I can just show you, you can see in this picture, this particular picture shows you what exactly a tongue tie is. Okay, so when I came to know that my son was born with a tongue tie, being in this particular field, I was able to evaluate with the pediatrician and intervene at the correct time. So, proper evaluation, intervention, and then treatment can solve a lot of problems. So, luckily, I didn't have problems with breastfeeding. Um, Now, coming to the medical term of tongue tie is called as ankylography. Okay, and it is seen more in baby boys as compared to baby girls. Now, there are a lot of classifications and a lot of variations in tongue tie, but let me tell you, there are two most important classifications. First is the anterior tongue tie, which you just saw in the picture. That is where the tie is located just at the tip of the tongue. Okay, and posterior tongue tie is at the back of the tongue, which is not easily detected. Anterior tongue ties can be detected. Why? Because as the baby protrudes the tongue forward, you will be able to see a notch or a heart shaped structure. Then we when we protrude our tongue, we can see a curvature or a smooth surface. Okay, whereas in tongue tied babies, you'll be able to see a notch. So this is the thing when tongue ties can create a little problem during breastfeeding. Now, coming to what all problems the newborn can face. Firstly, because the tongue is important to for the proper seal or suction, what really happens is the tongue is not able to latch, the baby is not able to latch properly on the mother's breast, and he or she is not able to suck the milk adequately, so there can be insufficient milk which the baby gets. Because of that, constant hunger pangs, no proper weight gain which the baby has, and maybe disturbance in sleep pattern. What all problems can a mother face? Well, a mother, because of the painful breastfeeding, she can have sore nipples, mastitis, or breast engorgement. Stress levels can increase. Okay, now this is about the problem which the baby and the mother both face. Suppose if the tongue tie is not evaluated at the right time, the child will grow up, and even though the child does not have initial feeding problems, the child might face speech problems, articulation of certain words. Not just that, the child can also face a problem called as mouth breathing, because he or she is not able to breathe properly with the nose. There can be malocclusion or crowding. So these are a host of problems that the child can face because of tongue tie. So I would like to answer a few questions if they are there. Okay, so the first question coming up is, what factors during pregnancy increase the risk of tongue tie in babies? Well, as I have mentioned earlier, tongue tie is a congenital condition. It's a birth condition where the babies are born with this particular condition. No factor as such can determine, whether a baby will be or will not be born with this particular congenital defect. Now, as I've shared my experience also, uh, me being an oral surgeon, I was not able to prevent this from happening to my child. So not we cannot point out to one particular factor which might increase the risk of tongue ties in babies. Okay. Okay, the second question coming up is, how can tongue ties be prevented in babies? As I mentioned earlier, uh, tongue ties cannot be prevented in babies. Sometimes there is a correlation of genetics, but it has not been proven. So you cannot really prevent tongue ties in babies. The only thing which can be done is proper evaluation and proper assessment of the tongue at birth. Okay, the next question is, uh, can tongue tie be treated and how? Yes, tongue ties can be treated if they are evaluated properly at an early stage. Now, as I mentioned, tongue ties can have a lot of classifications depending upon how thick or short the tie is, which attaches the tongue to the floor of the mouth. An ENT specialist or an oral surgeon or a lactation consultant or a pediatric dentist will be able to tell you that whether it needs any kind of surgical intervention. The surgical intervention of tongue tie is called as phrenectomy or phrenotomy. Phrenectomy is wherein the thick band of fibrous tissue which is attached beneath the tongue is incised completely, wherein the baby gets relief immediately. And phrenotomy means it is incised, but the frenum is repositioned. So, in babies who are less than 4 months of age, it can be carried out very quickly, and it is a painless procedure. and the babies do not experience a lot of pain, and they come back to normal. This can be performed without local anesthesia in babies who are less than 4 months of age. Okay. I face difficulty in breastfeeding my newborn due to tongue tie. How can I manage this? Okay, so the tongue creates a seal, and it is because of the protrusion of tongue and the movements of tongue that the baby is able to breastfeed well. If you feel that your baby has a problem, especially because of the tongue tie, you can go to your pediatrician or your lactation consultant and get the condition treated first, or first evaluated, and then they will tell you whether it has to be treated surgically, or it can be um, non-invasive method of treatment can be done. So there are two schools of thoughts. First is, there are practitioners who feel that until and unless the form and function of the tongue is really not compromised, and if the baby is doing well, there is no need of surgical intervention. But there is one more set of practitioners who feel that why to wait till the tongue tie actually starts creating problems, just deal with it at the earlier stage. So then they advise freenectomy. Yeah, also after the freenectomy procedure is done, it is extremely important for the mother to go for follow-ups, regular follow-ups and checkups, because the clinician or the surgeon will tell you that there are a few exercises which have to be done, that is stretching exercises, where the mother is taught how to take care of the tongue, how to make the tongue mobile. Because if adequate movement of the tongue is not done, adequate exercises of the tongue have not been performed, then there is a chance of the tongue tie getting relapsed, the surgery getting relapsed, and then there is no use, because mucosa is forgiving, and the tissues, they reposition very fast. So to avoid or prevent any kind of relapse, it is extremely important to really take care after surgery. Yeah. So the next question is, can babies with tongue ties undergo surgery? Yes. And what after do I need? Yeah. So babies with tongue tie, as I told you, they can undergo procedures, either freenectomy or frenotomy. Babies who are less than 4 months of age can do very well without local anesthesia. The freenectomy procedure or the surgical procedure can be carried out either by scalpel and sterile scissors, and or it can be done with surgery, which is called as laser surgery. Now, after 24 hours, the babies are absolutely fine. The only thing you have to take care is that the baby has been administered vitamin K, because it helps in the clotting. Babies who are a little older than 4 months will require local anesthesia, because as they start growing, the oral musculature, the oral structures too start growing, and the tie which is there, the band which is there, it starts getting more thicker, it starts getting fibrous, and because of that, it's a little difficult to carry out this procedure without local anesthesia. Yes, if the baby is not cooperative, uncooperative, is cranky, feels scared, this particular procedure might could be carried out in sedation or under general anesthesia. So always better to catch this particular birth condition very early in babies. Okay. So I would like to conclude my session saying that there is a very famous proverb called as this, stitch in time saves nine. So it is always better to evaluate, assess, and examine the tongue in babies at the right time, because this can really prevent any kind of problems further on, and it will really create a very good and beautiful bond between the baby and the mother. So with this, I end my today's session. And thank you, Baby Chakra, for giving me an opportunity to carry out a live session. And do follow me on my Instagram page, My Little Pram, and also Baby Chakra. Thank you and take care.